Hello, I'm Dr. Jeff Smith, and thanks for watching this video. We're going to talk today about how you can beat chronic pain. Chronic pain can be any number of things, from headaches to neck pain, shoulder pain, elbow pain, carpal tunnel syndrome. It can include low back pain, hip pain, knee pain, and even fibromyalgia. A lot of people suffer with those problems, and we want to tell you we have a wonderful new solution that's new to Northwest Arkansas. Again, I'm Dr. Jeff Smith. I'm with Smith Family Clinic of Northwest Arkansas. We're the state's largest functional medicine clinic, which means we treat our patients' causes to get rid of the cause instead of just treat the symptoms or cover up the symptoms with medication. We help them achieve completion of their care so they get over the problem permanently. I'm a board certified doctor. I hold 5 different degrees and certifications in everything from doctorate to doctor of chiropractic to acupuncture to nutrition to human biology and even functional medicine therapy. I've been in private practice here in Northwest Arkansas since 1998. I'm actually the author of several different books to help patients, and I also consult and teach doctors around the country. And of course, I'm the clinic director here at Smith Family Clinic of Northwest Arkansas. I'm going to tell you about a new program we have here. It's called Dr. Smith's 4-Point Chronic Pain Therapy Program. What that means is there's 4 cutting-edge ways that we can provide 4 different therapies to help our patients achieve their health care and get rid of their chronic pain and avoid things like back surgery or spinal injections or those kind of harmful things. There are other options out there besides surgery. Unfortunately, a lot of our patients are never told there's any other options besides surgery. They end up having surgery, and then once the surgery fails, they end up coming here anyway, so we can try and help them then. Even if there's severe arthritis in a patient, we're able to help those patients. 4-Point therapy is the most cutting-edge and revolutionary natural therapy available. It actually is new to Northwest Arkansas, and the combination of therapies that we use have shown fantastic results. Not all surgeries work out 100%. Folks, you know, when your doctor says it's time for surgery, there's no other options. I want you to do your due diligence. Go to Google and research it. Okay, research spinal surgery, research shoulder surgery or knee replacement therapy. Research at Google. Thank goodness for Google. Google has allowed people to get information that was at one point in time never available to them. What I want you to do is go to Google and Google success surgery rates or surgery rates of success. It's not a simple surgery when you go through surgery. There's a high risk of infection, a high risk of blood clots, all kinds of things. One of the leading causes of death in hip replacement surgery is because of fat that leaks into the blood system, causes a clot, and goes to your heart, stops your heart. A lot of people aren't told that before they have it. Go to something called PubMed.com. That's www.pubmed.com. This is a medical website that shows you the true research that's out there for surgery. Surgery success rates. That's what you want to look up in PubMed.com. You're going to be shocked at what you find. There's over 120,000 failure studies listed there where surgery has failed the patient, not worked, and or made the problem worse. At our clinic, what we like to start with when we see a new patient, especially for someone that's having a lot of pain, is a neurological evaluation. Check the nerves and the brain function. Our nerves control pain. Doctors overlook that a great deal of the time. They don't seem to pay attention to what the nerves are telling us. Folks, we got to learn to listen to our bodies better. We perform a neurological evaluation. What we check for are things like LDAs. LDAs are large diameter afferents. These are nerves that connect directly from our legs and arms to our spinal cord. LDAs tell us about vibration and touch. We also want to check your SDAs, or your small diameter afferents. Those are the nerve fibers that tell us about temperatures and pain. LDAs and SDAs stimulate something in our spinal cord called the lamina 2. Lamina 2. You guys can Google this if you want. You'll learn about this stuff. Lamina 2 is located in the actual spinal cord, and it inhibits pain and numbness. If your pain in your knee, for instance, isn't connecting to the lamina 2 through those SDA fibers, you're going to have a lot of pain, and you may even have numbness. Okay? When a lamina 2 isn't working, you're in chronic pain. Period. End of story. You're in chronic pain. Medicine has absolutely no solution for this. None. There's not a drug that does this. Okay? The average patient walking into our clinic has already been to between 10 and 11 different doctors. 10 or 11 different doctors who either haven't listened to them, or forced them on a drug or a therapy that didn't work, or had them do some sort of surgery that wasn't successful. And they're fed up when they come here. A lot of our patients walk in and say, "Doctor, I just want help. Help me, help me." You know, we want to help that type of patient. Muscle strength. When you come in, I'm going to evaluate your muscle strength. There's a lot of different muscles. For instance, for a knee patient, anybody that's had knee pain or arthritis in the knee, or even a knee replacement, these are the muscles that are important. And it shocks me that doctors don't look at these things. The psoas muscle, that's connecting your leg into your back. The tensor fascia latae, that's the muscle that runs along the side of the leg. The rectus femoris, that's the muscle that controls the stability of the knee. We need to check that. The piriformis, that's the muscle that connects your rear end and controls pain into your sciatic nerve. For those of you that have herniated discs or sciatica disc problems, the piriformis is very important. The popliteus, that's the muscle behind the knee. The deltoids, that's our shoulder muscles. There's three different deltoid muscles. The supraspinatus and infraspinatus, those are the muscles that connect to our shoulder and our neck column. The subscapularis, back behind the shoulder blade. Latissimus dorsi, those are the muscles that help keep our spine erect. And the scalenes, those are back in the shoulder blades. These muscles need to be checked, because if you test them, they'll tell us exactly where the problem's originating from. I can't believe doctors don't look at these things, but they don't. So let's talk about the different procedures that we use. There's 4 different major new procedures that we use. This one's a little hard to see on the video, so I'll just explain it a little bit. Point number 1 in the 4-point therapy program is the cold laser. Now the laser is the deepest tissue, basically it's the deepest penetrating laser on the market. The laser costs over $60,000, okay? What it does and what it provides to our patients is, number 1, accelerated cell growth, meaning the growth of new cells from damaged cells. It provides faster healing. It provides increased metabolic activity. Basically, it helps the body increase output of certain enzymes and oxygen. It reduces fiber tissue formation. A lot of adhesions form, especially when you have a surgery on a joint. The body likes to form adhesions or glue, and it kind of locks it up. The laser gets rid of those things. It's an anti-inflammatory device. It helps to reduce inflammation and swelling. It also increases nerve activity and blood flow. Our blood carries our nutrients and our oxygen to our joints that are healing, okay? And it also increases the action potential to optimize muscle action. Basically what it means is it helps the muscles fire or work better. The laser is a fantastic device. It doesn't burn the tissue. It's painless. You can't feel it. It just simply works. Point number 2 of the 4-point plan, horizontal electrotherapy. This is the most advanced electrotherapy on the market, and it is effective for back pain and neck pain, sciatica, and neuropathy. A lot of our patients have neuropathy of the legs and sometimes of the hands as well. Hand and foot numbness and tingling, osteoarthritis and shoulder pain. horizontal electrotherapy, basically communication between the cells take place in two different ways, bioelectrically and biochemically. Whether the cell is a bone tissue, a muscle, a ligament, or nerve, communication has to occur via the electrical currents and the chemical messengers between the cells. When cellular communication is impaired between cells, pain and disease occur, so that the normal functional state is lost. This causes a further breakdown in cellular communication. Basically, it causes disease to begin in the joint. This is one of the leading causes of arthritis in a joint. Until now, the use of bioelectrical and biochemical communication could not be enhanced with electrotherapy at one time. It had to be done at two different times, which is a very slow process. With horizontal therapy that we offer, point number 2, both electrical and chemical components can be treated all in one treatment at the same time. Saves the patient time, saves cost, and increases healing time. Point number 3 of the 4-point protocol, oxygen therapy. Who would have thought oxygen therapy, right? Oxygen therapy is very effective for increasing oxygenation in the blood to deliver more oxygen to our cells so they can heal. All right? It helps fight bacterial infections and stimulates the release of substances called human growth factors and stem cells. Folks, human growth factor and stem cell is the single most important discovery in modern medicine, probably in our lifetime. These are cells that can become any tissue in the body we need them to become. They heal damaged tissue. Oxygen therapy stimulates the growth of them. So when we use oxygen therapy for a patient that has had back problems or a back surgery that's failed, it helps to produce growth factor hormones and stem cells. They'll heal the tissues. They promote healing of chronic health conditions. It's the only thing that does, and oxygen therapy stimulates that. Oxygen therapy is essential because without delivering a higher dose of oxygen to the tissue that we're treating, cells cannot repair themselves. Now, when we examine a patient, we'll check their oxygen levels. The oxygen level should be between 98 and 99% in order to heal a chronic condition. If your oxygen level is below 98%, it means you don't have enough oxygen in your blood to heal any of the damaged tissues. They won't heal. Another thing that's important is our brain. Folks, our brain uses sugars and oxygens to actually work. That's the gasoline for the brain. Without that, our brain can't communicate to our nerve tissues. Excuse me. So we need oxygen in our system in order to heal. Okay? Point number 4, non-surgical spinal decompression. This is basically effective for things like non-surgery. We want to do something non-surgical to a patient. Okay? Spinal decompression therapy is a modern, non-surgical, no cutting, traction procedure that effectively treats low back pain, neck, and radiating leg and arm pain. This type of traction is very successful in relieving pain associated with spinal disc herniation. Patients out there that have disc herniation that are watching this video, this procedure will help you. Okay? It also treats degenerating discs, bone-on-bone discs in our neck and in our back that are smashing together. It also helps with facet syndromes as well. Some of you patients may have, your doctor may have said you have facet syndrome. We need to put injections in there. Injections don't treat the facet. They just cover up the pain for a short period of time, and then the pain comes back. Spinal decompression can actually open those joints and repair them. The success rates clinically are over 91% with just this therapy alone. Not counting oxygen therapy, horizontal therapy, or any of the other ones, or laser, none of them. Just decompression alone is over 91%. Imagine what happens to our success rates when we add the cold laser therapy, when we add horizontal electrical therapy, when we add oxygen therapy. Those rates go through the roof. What is spinal decompression therapy? Well, it's a type of traction. Basically, it creates a negative pressure. If we have two joints that are smashing together, it will gently and slowly pull those joints apart, creates negative pressure. The negative pressure brings in the bulging disc or the herniated disc. So if that disc gets pushed out and touches the nerve, decompression therapy brings it back in. Okay? It also creates a lower pressure in the disc that will cause an influx of healing because it brings blood supply, nutrients, and oxygen into the disc. Okay? And these things actually repair the damage to the disc. They fix it. It can be used for anything from degenerated discs, bulging discs, neuropathy, restless leg syndrome, numb hands and feet, balance disorders, herniated discs, slipped discs, facet syndrome, sciatica, and or pinched nerves. It's useful for all of them. Excuse me. What can it prevent? Well, number one on the list is spinal surgery. It prevents surgery, okay? It prevents painful rehabilitation that patients have to go back. It prevents spinal nerve block injections. It can prevent spinal nerve injections where they inject right into the spinal cord. It can prevent the side effects of steroids that everybody seems to get prescribed. Okay? And the side effects of the anti-inflammatories. It also prevents the addiction to opiates. Folks, you may not realize this, but OxyContin is the #1 prescribed drug in America. #1. It is a narcotic. And it is only given to a patient over a period of time until their insurance runs out. Well, when their insurance runs out and the doctor doesn't give it to the patient anymore, they're completely addicted to narcotics. So guess what they do? Instead of OxyContin, they go to oxycodone, or then turn to something that we all have heard of called heroin. That's correct. OxyContin patients end up heroin addicts because they can't get off the narcotics. They are so addictive. Spinal decompression therapy can prevent that patient from ever getting to that point. Doctors like me, we also like to look at blood work, and we want to check for inflammation in the body. If we have inflammation in a certain joint that's painful, it's not going to heal properly. We need blood work for that. Your doctor may not have run blood work on you, but we do. We want to check for blood sugar, our HbA1c, our 3-month diabetic ratios. Folks, if you have something like restless leg syndrome or sciatica, it means the nerve is being damaged to the point where it's starting to die. Okay? One of the leading causes of nerve death is high levels of sugar. If the sugar level's too high, it literally will eat the nerve alive. Okay? We need to check for that. BUN, which is blood urea nitrogen and creatinine ratios, tells us whether the kidneys are functioning. Sodium, potassium, these things help us learn about adrenal formation. Okay? Our adrenals control our energy levels. They control our sleeping patterns, our fatigue levels, whether or not we get rest at night. There are stress organs. Most chronic pain patients' adrenal glands are almost completely shot by the time I see them. ALT and AST, these are both liver enzymes. Our liver is very important for producing enzymes to help us break down chemical compounds in our body. Gut function, well, our gut is where our immune system lives. If we're an autoimmune patient and 90% of our immune system lives right here in my gut, it's really important we check that. We also want to check the immune system. Again, if you're immune or autoimmune, you can't heal. We need to figure that out. The only way to do that is through blood tests. We do genetic testing. Genetics are very important in determining predisposition to disease processes. There's all kinds of different gene tests out there on the market. MTHFR, that tells us about methylation. C677T, that's the homozygous gene. FORL2, that tells us about the support for your body's immune system, bone marrow, placenta. COMT, that's a gene that tells us about neurotransmitter biomarkers, basically whether or not your brain is able to communicate with the nerves. Okay? GAD1 and 2, that talks about reducing the conversion of glutathione and dysphoria It can cause a patient to have dissatisfaction with their life, feel depressed, have sleeping disorders, low muscle tone, or even spasticity. That affects a lot of Parkinson's patients. AHCY 1, 2, and 19. Those genes cause decreased activity, which results in low homocysteine levels. Basically, it causes inflammation. SOD1, that's associated with neurological disorders. SOD2 is associated with cancer or hearing loss. Also, shrinkage of the brain and our motor neurons, our movement ability. VDR, FOK1-TAQ1, that gene tells us about a decreased activity in the receptor sites that transport vitamin D. A lot of people are low in vitamin D nowadays. That is a major component in a healthy immune system. If you have that gene, you're not going to have a healthy immune system. If you're interested in eliminating your chronic pain without medications or surgery, that's what this 4-point program is for. Folks, that's what we do here at Smith Family Clinic. Call our office, 479-271-6992, and ask for the $47 chronic pain evaluation. For $47, we'll examine you, consult with you, and we'll even treat you, let you try out the 4-point therapy program twice. You can do 2 sessions for $47 to see if it's going to help you. You and I both know it will, but we'd like you to try it out first. And there's no risk for that. It's only $47, okay? Our office is here to get people better that do not have anywhere else to go. Folks, if you're at the end of your rope, you've been to all kinds of doctors, like most everybody that ends up here. Call us. We want to help you, okay? We exist for those patients that cannot get help anywhere else. That's why we're here. Okay, like it or not, we have one of the biggest clinics in the state of Arkansas, let alone Northwest Arkansas, for one simple reason. We get people better when other doctors can't. That's what we're good at. Please come to us as a last hope. If you've tried everything else, and go ahead, I implore you, try it. Try every other therapy on the market, and then come here for relief. Then come here to get fixed, because we'll fix you, okay? Do your due diligence. Research the Google stuff I told you about. Figure that stuff out. And when you realize nothing else is going to help your problem, call us. We help a lot of chronic pain and peripheral neuropathy patients in our office. If we accept you as a patient, okay, it's because we sincerely feel that we can help you. Part of why we want to have you do 2 sessions with us is to see if we feel like we can help you, because we're not going to accept a patient into our program if we know we're not going to be successful with that patient. You can read we have books in here of success stories. I have videos online of our patients' success stories. Read them, because you have an opportunity to be in that book. You have an opportunity to be in that video as well and be successful in treating your problem. We want that for you, okay? Here's my email address. If you have any questions, email me. Now, we're awful busy, folks, really, really busy. Give me a break, okay? If I can't get back to you within a day or so, I will within a couple days for sure. But feel free to email me your questions. I will get back to you. I care enough about our patients to do that. This is direct from Google. This is a study from Google. It says, when combined with surgical costs and medications, let's just talk about this for a minute. MRI, rehab, and disability. The average spinal surgery costs $100,000 or more. The direct costs are $169,000 for a lower back fusion and $112,000 for a cervical fusion. If you want to know why surgeons and doctors want you to have surgery versus telling you about other options out there that can fix you without surgery, this is why. This is a telltale reason, folks. The cost of knee replacement and shoulder replacement surgery is $80,000 for that. No wonder they want to do so many of them, okay? Research suggests that of the 500,000 plus disc surgeries that are performed every year, As many as 90% of those 500,000 surgeries are unnecessary and ineffective. This was a study done by Dr. Richard Deyo, D-E-Y-O. He's an MD, he's a medical doctor from the University of Oregon Health and Sciences. Okay? He writes, and I quote, "It seems implausible that the number of patients with the most complex spinal pathology has increased 15-fold in just 6 years." 15-fold. He goes on to say that a strong motivation for this is a financial incentive involving both the surgeon and the hospital. You want to know why there's 500,000 disc operations done every year? That's why. And over the last 6 years, the number of them have increased 15 times. Our population hasn't increased 15 times, but the number of surgeries has. Dr. Deyo and Dr. Churkin also did another study of an international rates of medicine of surgeries in 1994 and discovered the rate of American surgery is unusually excessive and directly attributed to the supply of surgeons. The rate of back surgery in the United States was at least 40% higher than any other country and more than 5 times that of England. We're 5 times higher than England. Okay? Of the top 10 lists of diseases in America, back pain stands at number 8. Number 8, folks. Forbes.com estimates back pain costs us $40 billion in treatment alone, primarily because of expensive surgeries that they may not need. He also estimates that when you count disability, work loss, total cost, and indirect cost, it can go between $100 and $200 billion. Back pain has sent over 3 million people to the emergency room in 2008 at a cost of $9.5 billion, making it the 9th most expensive treatment in America. I don't make this stuff up, folks. It's on Google. It's on PubMed, a medical research site. You can look it up yourself. It blows my mind. What accounts for these staggering costs? Well, doctors and hospitals are making huge profits off the backs, no pun intended, of unsuspecting patients who aren't told that there are other procedures out there like our 4-point protocol that will actually fix your problem and stop you from having surgery. Okay? I talked about OxyContin. Here's another case. It turns people into drug addicts for pain. Okay? Symptoms in the body are a good thing because they tell us there's a problem. The body is trying to heal itself when you have pain. Many of you have probably experienced death in your family. Have you ever noticed that right before your family member dies, while they're still alive, all their pain ceases? Do you know why? It's because the body finally gives up its effort in trying to stop pain. So the pain stops, and then the patient dies. So modern medicine nowadays focuses on treating symptoms and not cause. When you treat cause, the patient heals. It's not rocket science, okay? Here's a fact. The United States makes up 5% of the world's population. We're only 5%. But we spend 95% of all healthcare costs. Our country does. We account for 75% of all drug use as well. Our country. Here's another fact. A Dr. Barbara Starfield, she's a medical doctor, in July of 2000 did a worldwide study, studied the whole world, and found 12,000 people die a year from unnecessary surgery, 7,000 die a year from mistakes in the medication they take, 20,000 people die from the errors that occur in the hospitals when you're having surgeries, 80,000 die from infection that they didn't even have before they went into the hospital, 106,000 people die a year from properly administered drugs, and 225,000 people die every year from proper medical treatment. The numbers are staggering, all right? Here's another fact. In 2013, the United States was shown to be the 17th most unhealthy country in the world Folks, Mexico's ahead of us, okay? Mexico. We are more overweight. We have a higher BMI rate. We have higher infant mortality. We have higher diabetes. We even have a higher likelihood of death for people between the ages of 15 and 50. That's us. That's our health care. Okay? Here's a reason why. Here's another reason why. This is another example. Abilify. That's a drug a lot of people take as an antidepressant. You want to know why that drug is on every TV commercial you ever watch? You see it 5 times a day? Well, here's why. Medicare, the government insurance agency that pays for drugs for patients, they pay a staggering $4,200 for a 92-day supply of Abilify. $4,200. Who do you think's making all the money on that? The drug company. That's right. Okay? These kind of things like stem cells are out on the market now. Okay? Stem cells can heal the problem. But instead of healing the problem, we're going to give you $4,200 worth of medication. Okay? What's the success rates? Well, of surgery, doctors like to say, oh, only a few people have surgery. Only the worst cases have surgery. That's not true. We've shown that. Really? Okay? Every year, there's over 500,000 back surgeries. Every year. There's over 500,000 neck surgeries. There's over 720,000 knee and even shoulder replacements performed every year in our country. Okay? Patients come to my clinic from all over North America. We've had patients from New York City, Oregon, Texas, Kentucky, Louisiana, all over. They come here because we offer a service that's second to none. Number one, we use our 4-point therapy protocol. Cold laser, horizontal electrotherapy, oxygen therapy, spinal decompression therapy. Those things work. We have a very highly trained medical staff here. We participate in clinical research trials. Folks, we're actually part of the research that shows these therapies help patients. We do complete blood work on our patients. We look for things other doctors don't look for. Our clinic doctors actually care about you. Okay? I just got off the phone call with one of my patients from Florida. Called her on my own time because I care. Okay? And number 6, we have an extremely high number of successful cases over my 18-year career. We have books this thick with different stories of patients that have written thank you letters and encouraging letters for other patients. We want you to be in that book too. Okay? That's why patients come to our clinic from not only all this country, but from all of North America, Canada, Mexico. We have patients from all over North America. Waiting list. Let's talk about that. We have one of the most busy practices in this country. Okay? Yes, I have a waiting list. Okay? If you're watching this video right now and you want to be a patient, it may be a couple weeks before we can get to you. I hope you'll understand that and give us a little break. I know you're hurting. I know you're in pain and you want help immediately. And we want to help you. But there's a lot of people that reach out for our help and our services. And there is a waiting list sometimes. So if you call here and leave a message and we can't call you back right away, we'll call you back the next day. Okay? Be patient with us. That's all I can ask for. We care about you. We're extremely busy, our doctors and our staff, but we do care and we will get back to you. We will help you. Again, you can email me. Okay, my email is drjeffsmithdc@smithfamilyclinic.com. If you have any questions at all after watching this video, email me. If I can't get back to you right away that day, I'll definitely get back to you within the next. But again, I'm very, very busy, so I hope you'll understand. I do want to help you. I will get back to you, but cut me just a little bit of slack, okay? Folks, I hope this video has helped you understand that there's other procedures out there besides injections and surgeries and pain meds that will help you. You don't have to do those things. You don't have to destroy your body in a hope of fixing it. We can help with that. We're good at it. I'm Dr. Jeff Smith. I hope you guys have a blessed day.